It's Wednesday, February the 9th, 2022. Madam Secretary, please call the roll.
Senator Rocky Adams. Senator Byrd. Senator Carroll.
Here.
Senator Givens. Senator Harper Angel. Senator Howe. Senator Kerr. Senator Meredith.
Here.
Senator Nemes.
Present.
Senator Wise. Present. Chairman Alvarado.
Here. All right, we have a quorum. We're established to do business. Before we get started, I think Senator Carroll has an introduction.
Mr. President. I have a Carlisle County Magistrate here today, Miss Lisa Adams. This is her first trip for County Officials Day, and so she's in a learning process today, but it's good to see her up here. I've known her and her husband as a state trooper for many years, just a great family down in Carlisle County, and involved in the community in the area down there, Carlisle and Ballard County. So it's an honor to have her here today, and I would ask that committee please make her welcome.
Very good. Well, welcome to our committee. Also want to recognize today, I think, is the Kentucky Medical Association Physicians Day at the Capitol. You'll see a lot of white coats walking around the halls. We want to welcome our physicians and our doctors. Thank you for the work that you do in our communities. We know this last couple of years have been particularly difficult, so we want to thank you for coming today and for the work that you do and taking care of all of us back home. Before we get started on the two bills for consideration, we've got some items that we need to review. The first we're going to discuss are the half-year block grant status. We have 4 of them, and I don't know if we have if Ms. Bagan's on the call with the cabinet.
Yes, sir. Good morning.
Very good.
My name's Laura Began, representative for the Department for Community-Based Services.
Ms. Began, thank you for being here. If you could please briefly brief us on these grants and their status and what they're doing.
Yes, sir. These are half-year block grant status reports. We're required by statutes in KRS Chapter 45 to submit them every 6 months. The department actually receives 5 federally funded block grants, and these are subjects of social services, home energy assistance, child care, all different programs. These block grants also have different state plan submittal deadlines. The social services block grant preliminary plan will be submitted to you within the next month or so. That block grant preliminary plan is required annually. Other block grants have 2 or 3 year submittal timelines. Last year, the department presented on all 5 of the block grants that we administer, because it just happened that all state plan submittals fell in 2021. And I'd be happy to answer any questions you all have on these block grants.
Thank you very much. Any questions for members of the committee at all?
Comment, Mr. Chair.
Senator Meredith.
It's been wonderful we've had access to these funds, but to quickly add this up, comes out to about $445 million. And it's a lot of money. When you look at the total budget of the cabinet, it's, I guess, the largest cabinet in our state, but we really haven't had an opportunity to discuss these grants in detail individually, and that's not a criticism. It's just, I think, a problem with the system. We try to do these things in the interim, but it's just not enough time to do those things. But I make these comments in support of the Senate Joint concurrent resolution that we passed in the Senate a few weeks back. Would just encourage our colleagues in the House to do the same, because this cabinet has become enormous, and it's just difficult to pay the attention to the recipients and the impact that these grants have upon them and upon our state as a whole. So again, it's just a commercial, I guess, for Senate Concurrent Resolution 20 that we need to take a hard look at how the cabinet is structured, and I think we can do it better and do it more efficiently. But appreciate the time. Thank you.
Thank you, Senator. Appreciate that. Any other comments, questions? If not, let the record show that we've reviewed these grants as is required. Thank you, Ms. Began. Appreciate it. Next item on the agenda is going to be consideration of regulations. I think we've got members of the cabinet who are available here also to discuss some of these if needed. Any questions, concerns from members of the committee? I do want to draw attention, and maybe if we could have someone from the cabinet kind of answer this, there's regarding 902 KAR 20460E. It's the Essential Visitors Program, Visitation Guidelines for Long-Term Care Facilities. And staff had pointed this out, was a good catch, but this emergency administrative regulation was filed on October the 1st, 2021, and it was set to expire on January 31st, 2022. But we passed Senate Bill 25 out of the Senate, and I believe the House as well, and it was signed into law on January the 14th, 2022, and it extended several emergency administrative regulations related to COVID-19 until June 28th of 2022, and this regulation was one that was extended. Additionally, we just had Senate Bill 100 was signed into law on February the 7th to bring the provisions of this regulation and the Essential Personal Care Visitor Program permanently into state law. So we need to make sure that the Cabinet's aware to be sure that when the new emergency regulation related to Senate Bill 100 is filed in the next couple of weeks, that it's not in conflict with this previous emergency reg, because it's going to be extended until June. So I think we just wanted to make sure, maybe you guys can comment on this, that if once we do that, that we need to make sure that once the other one is done, this one needs to be withdrawn.
Thank you, Senator Alvarado. This is Adam Mather. I'm the Inspector General for the Cabinet. We are aware and appreciate you bringing that matter up, and we will handle that accordingly to make sure that they're not in conflict with one another.
Very good. Appreciate that. Wanted to make sure that everyone was, at least we got that on the record and everybody was aware that that needed to be, make sure we got that changed. Any other comments or concerns from members of the committee? All right. I'll let the record show that we've reviewed those regulations. We appreciate you being available. Now we'll kind of attack the two bills that we have. I'm the sponsor for both of them. The first one we'll cover will be Senate Bill 87, an act relating to Medicaid reimbursements for dental services. I'm going to turn the gavel over to my Vice Chairman, and I'm going to take the table down here.
Thank you, Senator Alvarado. If you would, sir, you know the routine. Identify yourself for the record, and then please ask your guests to do so as well. Thank you.
Thank you, Mr. Chairman. I'm Ralph Alvarado, State Senator for the 28th District.
Mahek Kalra with Kentucky Youth Advocates, Chief Policy Officer.
Thank you for joining us. Please proceed.
And I believe we also have some guests online. If Dr. Bobrowski and Mr. Coleman, if you'd like to introduce yourselves as well. I believe you're muted. Dr. Bobrowski, I think you're muted there.
Hello, I'm Dr. Garth Bobrowski. I hope you can hear me now.
Yes, we can. Thank you.
Computer.
I'm Ronnie Coleman. I'm Director of Government Relations for Benevis. Thank you.
Thank you, gentlemen. Mr. Chairman and members of the committee, thank you for the opportunity to discuss Senate Bill 87. This is a rather short bill that directs the Department of Medicaid Services to utilize a directed payment option to adopt a minimum fee schedule for covered dental services. It would require that any Medicaid MCO to reimburse Medicaid dental providers who see at least 50 patients during the previous year at a level equal to the established fee-for-service rate for the same service. There is a clinic in my district in Lexington that provides care exclusively for Medicaid patients, both adults and children, and they're barely hanging on. Really, Kentucky struggles to find dental providers willing to see Medicaid patients because the rates are frankly so low. And this clinic asked for me to introduce this legislation. There is a fiscal note that was requested also. I believe all members have had a copy of that sent to them in the last couple of days. Funding this bill would draw down federal funds at an 80-20 match rate. The expenditures were estimated between $3.85 million to $7.45 million, with a drawdown of between $14.65 million to $29 million from the federal government. There would also be an additional administrative cost of about $250,000 with a 50-50 match rate of an additional $250,000 from the federal government. I thought we'd start off today by having Mahek present some information, then we'll have the folks that are online as well discuss some issues and perhaps be able to answer some questions for you.
Thank you, Senator. Thank you all for having us join today. Kentucky Youth Advocates, we're the independent voice for Kentucky's kids, and our vision is to make Kentucky the best place to be young. Often at times you see us testifying to this committee on policy recommendations to protect kids from abuse and neglect, ensuring kids have access to quality education, help kids grow up to be healthy, strong, helping also working families make ends meet, and so much more. But today we want to talk about oral health. We know that oral health is an integral part of a child's development and learning, and there's no secret that Kentucky's history of poor oral health, there's no history. I should say, it's often obvious. You know, we talk about it so much. In a recent study, it showed that Kentucky is ranked 41st in the nation in dental wellness. We have the highest sugar-sweetened beverages consumption, and the highest percentage of adult smokers. These are all poor oral health outcomes. In 2010, Kentucky Youth Advocates helped reinstate the statewide Oral Health Coalition to improve oral health for all Kentuckians and every resident of the Commonwealth. And today, that coalition is comprised of 450 members and stakeholders across the state that represent dentists, dental hygienists, teachers, educators, and so much more. February is actually National Children's Dental Health Month, a time where dental providers and also advocates come together to talk about the importance of oral health, but also the needs around access to dental care and coverage. And now many of us have probably experienced tooth pain. We could all think about it. We could all remember that experience. And for children, when we're experiencing prolonged, persistent dental pain, it's difficult for them. We know it's hard for them to learn. And once in school, children with poor dental health are 3 times more likely to be absent than other children. And most oral health disease is preventable, yet routine dental care is out of reach for Kentuckians. The lack of access to care can leave people with few or no other options other than visiting the ER. And we know that the ER is costly not only to patients, but to healthcare system, our state Medicaid program, and also to taxpayers. So the bottom line is when teeth are healthy and pain-free, it's easier for children to focus, to listen, to play, to learn, to grow and thrive. And oral health is much more than a bright, beautiful smile. It takes establishing good brushing and flossing routines early in life and maintaining them. It takes more equitable access to dental care, such as Senator Alvarado's bill, Senate Bill 87, is doing, by elevating the Medicaid dental reimbursement. Kentucky has not seen an increased schedule in nearly 2 decades, and we believe in doing this, it will increase the providers that come to our state and provides those access to care and to accept new patients across the state. So it also takes a commitment from state leaders such as yourself here to allocate funds for Medicaid. And it also requires healthy food, safe drinking water in every neighborhood and community, which you all are already doing. So it takes all of us to recognize that oral health is health and it needs to be prioritized, not only in our homes, but in our communities and our state policies and budget.
Dr. Bobrowski, would you like to provide your insight and probably the experience of a dental provider here in our state?
Yes. Good morning, and thank you, Chairman Alvarado and the committee members, for allowing me the opportunity to remotely speak to you today about my support for Senate Bill 87. My name is Dr. Garth Bobrowski. My wife and I live in Greensburg, Kentucky, Greene County, and I've been an active Medicaid dental provider for over 41 years. I grew up in rural South Central and Southeastern Kentucky, graduating from Redbird High School. I'm a past president of the Kentucky Dental Association, the Kentucky Board of Dentistry, where I served 8 years, and the American Association of Dental Boards. Currently, I serve as the chair of the KDA Council on Governmental Affairs, chair of the Cabinet for Health and Family Services Dental Technical Advisory Committee, and vice chair of the Advisory Council for Medical Assistance. I understand what it's like to be poor, but I was richly blessed with great hardworking parents that emphasize what it is to care for people and their condition, and that became my calling. I see 2 issues where this Senate Bill 87 will be a great plus for Kentucky. With Medicaid, there is a declining access to care problem, and that's number one. Number two is there's a perfect storm brewing on the business of dentistry. Now, let me explain. Dentistry has not had a fee increase for the adult Medicaid population since 2002, which was based off of a 1998 fee schedule. Increased costs of supplies, infection control products, PPE, office IT and technology, the raising workforce pay, more administrative burdens, failed appointments, staff moving to non-Medicaid offices, and did I mention COVID? Many of the services we now provide are reimbursed at below cost. Many of you are business people, and how long would you work for a 1998 pay schedule? How long would your business survive? And we agree with Senator Alvarado, Senate Bill 87, to establish the floor that the MCOs must use and adjust their contracts. We've talked about that at the last TAC meeting. We need to put some jacks under each corner of that floor and raise it to offset the extraordinary cost to be able to continue providing dental care services in the state. The state and the MCOs may show that there's over 1,500 dentists that provide Medicaid dental services. That's the number on the rolls, but is not the accurate number of dentists and oral surgeons providing many dental services. We just had a report the other day that one of the TAC members, who's an oral surgeon, is no longer going to provide Medicaid services. Several of the state's older MCOs dropped their reimbursements by another 10%. This is just killing our ability to serve our populations for their profits. This bill would provide a safety net for Medicaid dental providers. And briefly, I just want you to know that the KDA has worked with various administrations, has a great working relationship with Secretary Friedlander, Commissioner Lisa Lee, and the MCO administrators. But I want to leave you with this thought coming from several Medicaid providers. They say, I can't work hard enough nor fast enough anymore to make ends meet. And Mr. Chairman and members of the committee, I hope you will support and fund this initiative. This is a step forward that will incentivize dentists to help address this need and to start increasing access to care. Thank you.
Mr. Coleman, anything you'd like to add?
Sure. My name is Ronnie Coleman. I'm Director of Government Relations for Benevis. We're a dental support organization that provides non-clinical support services for dental offices in 15 states. And in Kentucky, we support Ruby Dental. They're a kid-first, family-friendly practice with 2 offices in Louisville, 1 in Lexington in the Senator's District, and 1 in Elizabethtown. And we support Senate Bill 87. Ruby Dental, prior to the pandemic, saw on average 22,000 patients a year on 50,000 visits. They employed 15 full-time and part-time dentists. Now, Ruby Dental is down to 4 dentists with a commensurately low number of dental assistants and hygienists. A lot of that has to do with the rates and pandemic. The other issue that many aren't aware of is that generally in Medicaid practices around the country, and I'm responsible for 7 states, the show rate for Medicaid patients is low. In good times, it's 50% in our experience. Since the pandemic, we're seeing rates of 40% or even lower certain weeks when weather's bad. So that too is contributing to the challenge for Medicaid providers to be able to make enough money to continue seeing Medicaid patients. All of that in an environment of a state dental fee schedule that's over 20 years old. And what's worse is that the MCOs are reimbursing Kentucky dentists on average 15 to 30% less than that old fee schedule. It's unbelievable. And so the dentists are having a very brutal time with regular inflation, the hyperinflation associated with COVID, as Dr. Bobrowski mentioned, the extremely high cost of PPE, infection control, technology, and then staffing. In normal times, it's very difficult for safety net dental practices to compete with commercial dentists for staffing, but it's really hard now. And so Medicaid-oriented dentists, rural dentists are all on fixed incomes for the most part. They can't raise prices. They can't balance the low Medicaid fees with a high percentage of commercial patients. They can't ask patients to pay surcharges, all on a sub 2-decade old fee schedule. So our practices are closing. I know that the practices we support in other states have closed in the past 2 or 3 years, and I'm hopeful we don't get to that point in Kentucky. So Senate Bill 87 would require MCOs to make directed payments to dentists to boost them to that old 20-year-old fee schedule. And I know that's a suboptimal solution, but it's really the only remedy we have right now until the MCOs renegotiate their contracts with, until Medicaid renegotiates their contracts with the MCOs. And at that time, I would urge Medicaid to increase the fee schedule to a modern level, require MCOs to pay at minimum the fee schedule as this bill is requiring, and then require regular rate reviews for all Medicaid providers. Rather than waiting 15 or 20 years, maybe do it every other year. So with that, I thank you for your time. I ask you to vote yes on Senate Bill 87, and I'm happy to answer any questions.
We do have questions. Appreciate the testimony. Senator Givens.
Mr. Chairman, thank you. And I'm a brief comment and then a quick question for one of my colleagues and friends. First, a comment. Dr. Borowski, that testified just a moment ago, is such a valuable asset to our rural community. And Chairman Meredith, as you're chairing this committee today, and you and I have had multiple conversations, and you're always a passionate rural legislator speaking about access to care and the challenges in our rural community. And Senator Wise, you have a wife that works in this space, and you know the challenge of being in a rural community, largely rural community, and meeting the needs of these families. So Dr. Borowski, just a quick shout out to you to say thanks for your years of service, your continued service, your leadership across the state, the dedication day in and day out that you and your family show to our Greensburg, Greene County, and surrounding citizens. We need more of you in the world, and thank you for all you do. Quick question as we discuss the cost related, because often, Chair Alvarado, as you know, the cost question comes up. I did not realize it had been that many years since we'd reviewed this schedule. Mm-hmm. Is that typical in this space?
I can't speak for the dentist. Mr. Coleman might be able to. He's got more experience as to what to expect. He probably can answer that. But that, unfortunately, in the entire medical community has been the case. Even amongst physicians, I can say that we're dealing with very old fee schedules. We have often relied as a state and as a country on the goodwill of our providers to make up the difference on this. And so that we just say, these are folks that have dedicated their lives to taking care of us. You know, we'll keep putting strain on them, putting pressure on them. They'll be the ones to fill in the gap. And unfortunately, that goodwill's starting to run out. And the pandemic has put that much more strain on folks. It's getting difficult. And you realize that 36% of our population in the state has Medicaid. Mm-hmm. These are adults, kids. If they don't get, there's very few providers that offer these services. And so, again, this bill doesn't really increase that fee schedule. It just makes the MCOs pay at the previously agreed to fee schedule, which is still woefully deficient. You can imagine how much more expensive that would be. I'm hoping that Medicaid will take a look at this, as it needs to across the entire service line for services. But this is just going to make them pay at that old fee schedule to pay the base minimum. It just raises the floor to say you must pay this, because the MCOs are paying a lot less than that. Mr. Coleman, maybe you can provide more insight. He understands more of the business angle from the dental providers.
Sure. So I'm responsible for government relations in like 7 states, and I've been responsible for other states too. And I will just say that Kentucky's not alone. Many states have neglected rate increases for dentists for a long, long time. But I'll give you a sort of a positive example, and that's Georgia. Unfortunately, Georgia has an MCO system like yours, and we're paid below sort of the rate schedule level by the MCOs, but they review the schedule every year. For the past 4 or 5 years that I've been responsible for Georgia, they've either increased hygiene fees 3% or restorative fees by 1%, then hygiene fees by 7%. So they review it every year, and then we get some kind of rate increase that flows through the MCOs to the providers. But Indiana has not increased their fees in, 15 years. West Virginia has recently increased theirs. So there's a hodgepodge. Wisconsin just increased fees 40% last year for Medicaid dentists. It was long overdue, but it's very welcome. So hopefully that answers your question.
Thank you, Senator Givens. Senator Carroll.
Thank you, Mr. Chairman, and Senator Alvarado. Thank you for bringing this bill. And in our part of the state, it's a terrible problem there. And the population that I work with, the disabled population, it is a struggle for our folks to find a dentist, especially those who have severe disabilities. They often have to travel. Lee Specialty Clinic, I think that's Louisville, Lexington.
Yep.
So I wish we had more of those services throughout the state for those folks. My question is this, and this kind of brings to light, it's concerning that a provider should be paid less than the Medicaid. That should be the basic minimum for any MCO to start with. And is that something that maybe we need to look at as a bigger picture in dealing with the MCOs to make that, to put that floor into statute so we don't have these issues?
Again, and everybody knows I've been a very vocal critic. A lot of our MCOs, Senator Meredith and I have had lots of discussions. Maybe something, as he's been talking about this proposed task force, maybe something we need to take a look at in that task force to start making sure we're taking care of our providers. We know that once we lose providers to other states, it's difficult to get them back. And we talk about having students, but we talk about residency and a lot of those kinds of things that once people start their practices, they get their roots down. We want to keep them here and take care of them. But again, I think it's something we need to take a look at. We often urge, it doesn't matter who's in the executive branch, for them to be able to handle this issue and hold those institutions, those insurance companies to their contracts. But a lot of times, again, that gets overseen, so we have to take action for something like this. But it would make sense that you would think if you have a contract, you've agreed to an amount, that's what you get paid. When they get paid less, the healthcare field's the only field where you can say, I'm going to charge a certain amount, you get paid a quarter of it, and you just smile and take it, and you can't do anything about it. So it's something we need to take a look at, I think, as a state.
Very good. Thank you. Thank you, Mr. Chairman.
Thank you, Senator Carroll. And we have someone from the cabinet that would like to speak on this measure. So please identify yourself for the record and proceed. You're muted. We can't hear you.
Sorry. Hello, this is Donna Vino. I'm Director of Telehealth Services for the Cabinet. I just want to make sure that any type of dental services that are provided through asynchronous and synchronous telehealth services are also reimbursed on this fee schedule. Because I know more and more dentists are starting to use telehealth in the dental area. They send images to other doctors, and as it was said earlier, oral health is health. So we want to make sure that telehealth is also included and that it gets reimbursed on that fee schedule.
Thank you. Excellent comment. Senator Berg.
I would just like to make just one comment that I don't think has actually been made in the room, and I think it's important for people to understand oral health is not just a toothache or not just, I can't chew well because it hurts. Oral health has a tremendous impact on cardiac health and vascular health in adults. And actually, oral health can be the foundation of other disease processes that are very destructive to the body and cost us a lot of money to treat. So it's, again, one of those ounce of preventions is worth a pound of cure. This is, I cannot tell you how much I appreciate this bill being brought forward and how important good dental health is for the overall health of human beings. So thank you.
I'd like to speak to the fiscal note or the lack of it. And it goes back to something you said earlier about we need to allocate funding. I think the funding's there. We need to reallocate the funding. Mm-hmm. I wonder if we have any data whatsoever that measures how many Medicaid patients are going to ERs for dental problems. Do we have any data at all?
We I don't have any in front of me, but I could certainly look back. I'm sure the Hospital Association probably has some data on that as well, but I could certainly get that to you.
Well, I think that consistent with Senator Berg's statement about, dental health is kind of a precursor to all our health issues, and we don't look at the cost of ignoring these problems as significant. And while this fiscal note says it's going to cost us more, I think in the long run it's going to cost us less.
Certainly.
But we have to be able to measure that. And I certainly appreciate Mr. Coleman's testimony. We had a good conversation a couple of weeks ago about this, but I'm a little bit dismayed that our MCOs the last 10 years have done such a wonderful job in improving the health of our population that this is an issue. That plus network adequacy, that's one of the things we select them on, and they say those networks are there, and obviously they're not. We have dental deserts. There's no doubt about that. So again, if you look at this solely from a business model, there's significant savings to be realized by making this change, and I think long term we will actually see that it's cost us more to do nothing than take this kind of action. So I think great testimony today. If there are no other questions, I would entertain a motion for approval. Motion by Senator Adams, second by. Thank you, sir. Motion is second. All those in favor of the motion vote aye, and all opposed will vote no. Please call the roll.
Senator Rocky Adams. Senator Berg. Senator Carroll.
Aye.
Senator Givens. Senator Harper Angel. Senator Howe.
Aye.
Senator Kerr. Senator Meredith.
Aye.
Senator Nemes. Senator Wise.
I'd like to explain.
Please proceed.
Mr. Chairman, I first want to thank the bill sponsor. I also want to thank Dr. Bobrowski for testimony, but due to Section 57 of the Kentucky State Constitution, my wife's profession and the career, abstain from voting.
Thanks, sir. Appreciate that.
Senator Wise, or Senator Alvarado.
Aye.
Vote is 9-0. The bill passes with favorable expression. Thank you. Congratulations. We appreciate the testimony.
Thanks, Mr. Chairman. Thank you, members of the committee. Thank you to all the presenters. Mr. Chairman, if I might, the next bill, with your permission.
Well, we'll see. Now, please proceed. Go ahead. We've got time.
Thank you, sir. The next item is Senate Joint Resolution 80. This is a bill that was brought before this committee during the special session, and then I've filed once again. That effectively is establishing that the Commonwealth of Kentucky would recognize a positive COVID-19 antibody test as equivalent to having been vaccinated against COVID-19. I know many of us have been hearing from a lot of constituents with concerns, and I've heard particularly from medical professionals, physicians, nurses, many of them in the line of duty who have contracted COVID-19, many of them for various reasons who perhaps have not taken a vaccine, don't wish to take a vaccination, but have said, I've already been exposed, I have a measurable antibody level, and that I should have the equivalent of being recognized as such. I did a bit more research on this and started looking at some of the data since our meeting in September, and I've noted we've had several studies that have been produced looking at the level of immunity from natural infections. I know Johns Hopkins did a recent study. The World Health Organization has a scientific brief based on natural immunity. And we still have the original, white paper that I brought from Australia looking at neutralizing antibody levels as being highly predictive of immune protection. We've had more and more studies coming out to the point now that we even have international governments that have begun to recognize this as being equal to being vaccinated. For example, if you wish to travel to, and I think I wrote them all down here, all the countries in Europe, and I'll list them: Albania, Andorra, Finland, Iceland, Ireland, Montenegro, Serbia, Austria, Bulgaria, Denmark, Estonia, Germany, Hungary, Italy, Latvia, the Netherlands, Poland, Slovenia, Spain, Sweden, and Switzerland, just in Europe. That now if you want to travel to their country, you have to have proof of vaccination or proof of previous infection with antibody response, recognizing that to be equivalent. I think we've gotten to a point right now with the pandemic, which is now moving into an endemic stage. The government has done its role. It's produced a vaccination. It's available. We've had many discussions, many urgings from people on this body and in various levels of government, both on federal, state, and local, to urge people to get vaccinated. People have made a decision whether or not they want to have that done or not. There's now acute treatments available with a drug called Paxlovid, which has been approved for acute treatment of acute infections of COVID. It's to the point now where it's people's decisions and choices to make those. But for a lot of individuals that are out there, we know there's a lot of urgencies that I think it's time for the state to be able to recognize, as many international governments have, to start recognizing people that have a measurable antibody response. And the way it's listed here is to the 20th percentile or higher, to start recognizing that as being equivalent to being vaccinated. Again, that 20th percentile level comes from the study. We heard a presentation during the interim and during the special session as well about neutralizing antibody levels and measures of those. That would incorporate 80% of the people out there, if they have a certain antibody level, that would count as being equal to being vaccinated. Again, with the thought that immunity on this is not lifelong necessarily. It's for a period of time. Again, I looked at recent studies which are saying that these antibodies are lasting at measurable levels, upwards of 1 year for people that have had a natural infection. And so therefore, the expiration of this joint resolution would be January 31st of 2023, which would be a little under 12 months from now, as far as being recognized. Again, this committee has heard this. It passed the Senate last year, and I bring it before this body for consideration again.
Please call the roll.
Senator Rocky Adams. Senator Byrd.
Explain my vote, please.
Yes, please proceed.
I am still a hard no on this. The data is starting to come out. It will eventually, possibly, be useful, but at this point, there are no CDC, FDA, World Health Organization, nobody is recommending this at this point. The data is starting to come out. It is going to take a while to see what the difference in natural immunity versus vaccine-induced immunity versus, the combination of both, which we know is by far the best and most protective at this level. And until we have that data and we have it strong, there's no way I would be in favor of this. On top of that, at this point, my understanding is the only mandates for vaccination in the state right now would be for healthcare workers and private employers. I don't think the state, and somebody please correct me if I'm wrong, is requiring any vaccinations at this point. So I do not see the purpose of this. It is not good science. I will state that unequivocally. And I am voting strongly no.
Senator Carroll.
Aye.
Senator Givens. Aye. Senator Harper Angel. No. Senator Howe.
Aye.
Senator Kerr. Senator Meredith.
Aye.
Senator Nemes.
I'd like to explain my aye vote.
Yes, please.
Maybe the data isn't in for this, but I think it's common sense that if you've had the disease or you have your immune system tested and that you're more likely to be immune to it, that this is a common sense thing. The data is in that if you've been vaccinated, you still catch the disease. Thank you.
Thank you.
Senator Wise.
Explain my vote.
Yes, please.
Thank you. I strongly vote yes. Senator Alvarado is supporter of this back when we had this during the special session. I think it's even more time to get this passed now. Thank you again for bringing this legislation forward.
Chairman Alvarado.
If I explain my vote, Mr. Chairman.
Yes, please.
Again, the medical communities of several countries in Europe would argue otherwise, that there is plenty of data on this. I would encourage those who question if there's data to research, to do simple literature researches on the numerous studies that are out there that are showing that natural immunity, and again, it makes common sense with so many other disease states that we have now, that if you have measurable antibodies, we're considered immune. The discussion doesn't need to be about vaccination. It needs to be about immunity. And again, it's not necessarily lifelong immunity, but that's what the discussion needs to be. Just like we have influenza, if you caught the flu for this year, do you need to have a flu vaccine on top of it if you've already had the flu? If you've got the current strain, not necessarily. It may change year to year, but again, this goes for 12 months. It goes in line with many of our European international governments that also support this concept. So I cast a yes vote.
Thank you, sir. The vote is 8 ayes, 2 nays, so it passes with favorable expression. Thank you, Senator Alvarado, for bringing this resolution forward. Is there any other business we need to conduct? If not, we stand adjourned.